Okay, let's begin. Before we begin our next panel, Rima Rudd will provide us with an exercise to challenge our numeracy skills and understanding. Dr. Rudd is a member of the Roundtable and is a senior lecturer on health literacy, education, and policy at the Harvard School of Public Health. Following Dr. Rudd, we will have two presentations focusing on numeracy, demands, assumptions, and challenges for consumers. Lynn Quincy has a degree in economics and is a senior policy analyst for Consumers Union, and she will speak with us today about choosing a health plan. And Dr. Andrea Apter is professor of medicine at the Hospital of the University of Pennsylvania. In her research, she explores the relationship of numeracy and health. Dr. Apter will discuss specific numeracy and healthcare issues. Dr. Rudd, will you please introduce the exercise to the audience? And then following Dr. Rudd, we'll ask Ms. Quincy to make her presentation.
Thank you. I'm not really a speaker. This is a 2-minute exercise that we will return to towards the end of the day. And it's called Deconstructing Health Activities. And so the deconstruction process is really to look at a health activity that we commonly take for granted or commonly talk about as a thing. And then it's important to delineate all the associated tasks that go along with that activity and to consider the literacy skills that are needed for that task. Then, in the deconstruction exercise, we look at the tools that people might use in order to accomplish that task. A tool might be, for example, a clock. You know, if you have to take your medicine and you can't take your medicine 2 hours before you eat and you know that you're eating at 1 o'clock, how do you compute that, especially in the world of digital clocks? You know, counting backwards, for example. So the tool would be the clock. And then calculate the literacy demand. So this is the deconstruction exercise. What I'm going to ask you to do as time passes, when you have a moment or two to start taking notes, is to build a list. So I want you to think about the activity that we often talk about as taking medicine as prescribed. People are compliant or not compliant. That activity of taking medicine. Then I would like you to list all of the associated tasks that you can think of that a person needs to engage in order to accomplish this activity and complete it. And then list all the associated tools a person might need to use. But I would want you really to focus on, to be able to star and count the numeracy tasks that are involved in that. And I'll just give you a brief activity like a starting point. Taking medicine, here are just some startup things. Pick up your meds, check that it's the correct one, read and comprehend the instructions, talk with the pharmacist or sign, the waiver that says you don't have any questions. Read and comprehend the label. But if you look at reading and comprehending the label, you start seeing some numeracy tasks there. You have to look at the strength, you have to look at the dosage, you have to look at the number and amount, the date of refill or the number of refills, and any instructions for time or day about taking it that includes numbers. So that's what you would star. So at the end, I'm going to come back and just in general ask people how many tasks they were able to list out that involve that activity of taking medicine, how many of those tasks involve numeracy, and then I might call on a volunteer to list out those numeric tasks, just to give us a sense of the overwhelming demand that's involved in something that we often take for granted. That's it. Thank you.
So we all have our assignment for later in the day, and I think we probably can multitask, that we can do this while we're also listening to the presentations. In fact, you have about 5 minutes right now to do that or to talk to your neighbor while we bring up a video. Yeah, we're going to.
Well, I'll sit here while you do the video.
Yeah, okay.
Well, she's got to load the video, so that's why we have about 5 minutes for people not to get out of the room.
And list the tasks involved with the activity of taking medicine.
That's right.
Great. As a challenge to you, I've had people come up with anything from 15 to 30 tasks.